in the case of first aid and emergency care, we need to understand what is a first aid and what are the different types of first aid. Here you can see what is the meaning of the word first aid. Please listen here, don't talk in between. So first aid mainly means an immediate care. Immediate care means if somebody has an accident, what we are normally doing, we may be giving them some band-aid, or we may be applying some ice. So these are the common things that usually we are doing. So it is an immediate care given to someone injured or ill, and the aim of that is to preserve the life, to prevent that complication from getting into a life-threatening situation. We are giving that first aid. So most of the time to prevent the loss of blood and preventing the condition from worsening and promoting a faster recovery. So that is the definition of the first aid. It's an immediate care given to someone injured or ill with the aim of preserving the life and also promoting faster recovery. That is the definition of the first aid. Now, emergency care involves professional intervention to stabilize the life-threatening situation. So there is slight difference. First aid means anybody can give the first aid, but usually the emergency care means emergency care is usually given by paramedical team, like the ambulance team. They have been given some training, and those are the people who are giving this emergency care usually. Now, what are the objectives of first aid? In case of first aid, the primary one important aim of the first aid is to preserve the life, to prevent the death of that person. So that is the preserving the life of the person is one of the important objectives, is to ensure that casualty survives long enough to receive professional medical care. For in the case of a road accident, if the person is having a lot of bleeding either from any part of the body, what we can, an ordinary person can do is to apply some band-aid so that the loss of blood can be minimized. Otherwise, before taking him to the hospital, if he lost a lot of blood, he may die. So that is one aim, preserving the life, prevent worsening of the situation, minimize the risk of the injury and illness from getting worse. And most of the time, if it is bleeding, we have to prevent the bleeding. If it is burns due to fire or something else, we have to apply some ice or something else so that the burns may not get more complicated. Another is promote recovery. So that's the three primary aims of this objectives of the first aid. In case of the third objective, it is speeding up the healing process. For example, if we are applying ice in the case of a burns, so the ice will prevent prevent many cells and tissues from getting dead, so that the recovery may be more faster when we have taken them to an hospital. So these are some of the advantages of this first aid. So one is preserving the life, prevent worsening, third is promote recovery. Now there are three important steps in first aid, and these are usually termed as ABC of framework. A stands for, please keep quiet there. A stands for airway, B stands for breathing, and C stands for circulation. So these are the three primary approaches in that. We will go into the detail. First one is the airway. Airway means ensure that airway is open and not blocked by tongue or any other obstruction. Airway means from our nose there is one tube, nasal canal is there, that is going to throat. From throat there is pharynx. From the pharynx there is a tube going down, and that tube is known by the name windpipe. Windpipe is dividing into bronchus, and bronchus is finally ending in lungs. Devika, please keep quiet. So these are the three. These are the main structures there. One is airway. So we have to make sure that airway is clear. So sometimes during some injuries, if there is some object in the mouth of the person, the person may not be able to breathe properly. So these are the problems that happen. So making the airway clear and free of any foreign object is one of the important aims. Second aim is breathing. Check if the person is breathing normally. If the person is breathing normally, it means that person has a better chance of getting normal, a better chance of recovery. If they are in administer rescue breath or artificial respiration, sometimes if there are a lot of brain is affected, the brain cells need a lot of oxygen, and if there is a lack of oxygen for 10 minutes or 15 minutes, most of the time brain cells will die. So to prevent that, we have to apply an oxygen supply, and best method is by giving oxygen cylinder. If that is not available, we can breathe into the mouth of the person by holding the nose closed. So this is the method by which we can pump some oxygen or pump some air into the body of the person. And third factor is circulation. And here ensure that there is, by simply pressing a finger here or just here, you can see that there is some pulse will be applied there. So check that the person is having a normal pulse, and that is also a sign that the situation is not so complicated. So ensure that there is pulse. If necessary, perform chest compression to maintain blood flow. Sometimes there is a technique called as CPR. Cardiopulmonary resuscitation. That is the meaning of the word CPR. I will show you a picture of that. In that, we will be applying some force or pressure on the chest of the person, so that if the heart is stopped, it may sometimes recover. So these are the three main steps in the first aid, ABC framework of first aid. A stands for airway, B stands for breathing, and C stands for circulation. Now, what are the general steps in a normal first aid? First thing, we have to survey the scene, ensure that this area is safe for both rescuer and victim before administering it. For example, in case of a fire in a house or fire in an office, the first thing we have to make sure that if the person is inside that building, the rescuer who is going to enter is also well protected. And usually how these fire force people are doing, when one fire force person is entering, another person may be usually throwing water on that person, so that his body temperature may not rise. So these are some of the techniques by which we can make sure that the rescuer is also safe. Then call for help. Advantage is that our fire service, fire and rescue team, they are properly trained. They have better equipment than most of us. So in such situation, only if they are coming, maybe we can serve the person more faster. Assess the condition, evaluate the injury or illness, focusing on life-threatening situation. So sometimes when a lot of people are having problems, our doctors are selecting those people who have more life-threatening situation. Doctors will be attending them more first, because if there are 50 people, only 2 or 3 doctors, they cannot attend all the 50 people at a time. So what they do, they select only the most critical patient and give them treatment, and next comes the next critical patient. So this is how the treatment protocols are usually done. The administer first aid provide care based on the situation. Those who need more care should be given better immediate first care. That is it. Monitor the victim, continue checking the vital signs and condition while waiting for professional help. So these are some of the important steps that we can do in a first aid. Now, what are the essential first aid techniques? One is CPR, as I told you. CPR, I will show you a picture of CPR. So this is how the CPR is usually, this is how the CPR is usually done. They will be putting on the chest of the patient they will be holding, keeping hands like this and apply some pressure. And a purpose of that is to recover the heart. Sometimes heart stops working, as in the case of some heart attack, clot, stroke, etc. This kind of problems will be happening. So that technique is known by the name CPR. Then another is Heimlich maneuver. I will show you if it is available. So this is another technique. The purpose of this Heimlich maneuver is that, for example, if some child or has taken some ball into the mouth, small ball, then the ball has stuck in the throat. What happens if it is not immediately removed? The ball will prevent breathing and the person may die. So in such a situation, most of the time what they do is that they are holding the hand like this and press on the abdomen. By pressing on the abdomen, sometimes the ball may, after many times pressing on the abdomen, and same time also patting on the back of the person. So 2 steps are give 5 back blows with the hand, give 5 abdominal thrust, and repeat it until the object is finally out of the mouth. If there is some ball or something, this is the technique that you can do. Normally when very small babies are at home, always we have to remove any small objects. For example, anything baby that can be put into the mouth, we should remove from the house. Otherwise, there can be a source of danger. So these are some of the normal things that and this procedure is Heimlich maneuver. So in case of an object stuck inside the mouth, this is what we can do, Heimlich maneuver. Then bleeding control is another step that we can do. What we can do in case of bleeding, we can apply some band-aid or something. So that is the technique that we can do. Then shock management, that is another important thing. Shock management. See, these are how the shock management techniques can be done. See, place the victim in a shock position, they keep the person warm and comfortable. See, the legs should be on a higher position. When a person has an electric shock or something, this is what normally, then turn the victim head to one side if neck injury is not suspected. These are some of the things that we can do. Then in case of burns also we can do. See, there are a lot of things that we can do for burns. See, one is expose the burn area. So this is one there. This is a normal thing that we are doing, especially when women are working in kitchen. Sometimes oil or other things may splash into the skin. Apply with plenty of wash under plenty of water. Then cover the burn area with a cling film so that there will not be any swelling. Then treat for the pain. So these are some of the techniques that normally that we are using, and so that is the case for burns. Fractures are there. So in case of fractures, see, this is what normally we are doing for a fracture, because most of the time this kind of thing happen when somebody is playing. So one is to restrict the movement, first aid. If the hands are broken, do not move that hand much. So that is one thing. So what we can do is that if there is a make that hand or leg, immobilize that hand or leg, then immediately take that patient and to somewhere. Then sometimes some people may have a shock problem also. In that case, we have to keep their legs on a higher level. So these are some of the things that we can do in case of a shock. Now the next another for is seizure. Seizure means in Malayalam we call it as abasmaram, chudali or other thing. Sometimes you might have noticed that. See, these are the seizures are actually a problem that happens when the electricity of your brain has suddenly gone abnormal. And normally what happens is that the person may fall down and he or she will be moving their arms, legs, etc. violently. And this will happen for 5 minutes or sometimes 10 minutes. And after that the patient become normal again, and this is the normal situation. So sometimes our people will say that give them some iron or something to hold, then it will be okay. But there is no meaning in giving iron or some metallic object. Usually this seizure may last 5 minutes or 10 minutes. So when somebody is giving some iron or object, then after that 5 minutes it will naturally be over. Most of our superstitions are based on this kind of beliefs. So one thing is we have to act calm. There is nothing we can do, just to keep the person in a, so that if there is any furniture or other thing, move it away, so that he will during violent movement he will not create any injury, body injury. And we have to also check for the mouth. Sometimes he or she may bite the tongue. That is also another complication. So these are the normal thing, and we have most of the time it will be over after some time. So these are the things that we can do. The act calm, create a safe space, cushion the head. Head may not move violently and get into some and hit on something. So this, if there is any wall or something, we can put a pillow or something. So these are something that we can do to prevent any bodily injury to that patient. So after 5 or 10 minutes it will be over. Then next one is poisoning. In case of poisoning, there are different types of poisoning. So most of the time, one important simple thing that we can do is that whether it is there. So in this inhaled poison, open door and windows to prevent fresh air. If it is, for example, there is a gas known as a carbon monoxide. Here we don't have that problem much. But if you go to European countries, they are using this gas heater. And in the room, there is a thing called a room heater. And most of the time this room heater is working with the gas. Sometimes, rarely, if there is any leak or something, this room heater can create carbon monoxide poisoning. The problem with the carbon monoxide poisoning is that this gas doesn't have any smell, doesn't have any color, and it will not cause any irritation. So if carbon monoxide poisoning is there, nobody can dictate it, no human being can dictate it. Only after some time this carbon monoxide poisoning can create complications. But the problem is that when carbon monoxide gas is present, our hemoglobin will combine with the carbon monoxide instead of oxygen. So what happens is that our blood will not be attaching with oxygen, it will be attaching with the carbon monoxide, and body will be short of oxygen, and that will lead to death. So that is the problem of carbon monoxide poisoning. So what we can do is that if there is any air pollution, open the doors and window. Then swallowed poison. In case of swallowed poison, if somebody has taken, give them plenty of water. That is one thing. Then give them milk. So most of the time how this poisonase is working is that poison will be causing precipitation of protein in our stomach and body. So when we are drinking milk contains a lot of protein. So we are giving them an additional protein material to cause precipitation. So when milk enter into the stomach, this milk will be getting precipitated. But if there is no protein, other foreign protein, that will be precipitating our stomach cells, and that will be dying. So this is then poison on the skin, and this is also another thing, and we can wash with a lot of soap and water. Here also the flush with a lot of lukewarm water for 10 to 15 minutes. Sometimes in chemistry lab and other things you can come across this kind of problem. So one thing that we normally do not do in India is that when we are working, we never use any gloves. Use of gloves is not common in India, but when we are handling dangerous objects, it is always good that we are using some kind of gloves. So that is another technique. Then hypothermia. In case of hypothermia means it is not happening here because we are living in a very tropical country and we do not have any problem of hypothermia. So here you can see that this is a very dangerous situation. Immediately if you do not treat the patient, what happens is that the person, most of the time, the extremities of the body, like hand or leg. For example, if you are in a country where the temperature is below 0 degree, then if your hands are outside, most of the time fingers will get frostbite. If your legs are outside, so last month I was in Ireland, and there my relatives are telling that put your hands inside the pants or inside so that hands will not be exposed. So these are, so usually any exposed part, your hands, your nose, your ear, your legs, these extremities of your body are receiving less blood than other body part. So the amount of blood reaching your finger is much lower than amount of blood reaching this part. So that when there is frostbite, these are the parts which are affected. If it is completely affected, we have to, the only thing is that it is to cut away and surgically cut away that portion. Nothing else we can do. So hypothermia occurs when body loses more heat than it can generate, and it has a lower temperature. The important thing is to give them proper medical care immediately, take them to a warmer place. And these are some of the, so we do not have a climate like that. Sometimes nowadays every Malayali is going to different parts of the world. To which country we need to go, nobody is right now going. Last week one of my relatives is going to Moldova. When I checked about Moldova, she is going to study MBA there. It is a very poor country in Europe. But what they are saying that if I go to Moldova, I can get Schengen visa so that I may be able to move to some other country again. So this is how the people are now thinking. You do not know to which country you will be going. So wherever going, to which country, this cold situation is a very different situation, difficult to manage for people. For example, if you are living in a cold, your face, your skin, everything will be after some time. Now there will be injury, there will be bleeding from your skin, there will be cracks on your face. So it's a very difficult situation. You have to constantly take care of your skin, otherwise skin may get broken and there will be bleeding. Then another heat stroke. Heat stroke is also another situation. See, these are the things that we can do in case of a heat stroke. See, it's not clear. See, these are some of the things. It's also very small to read. Okay, this is better. So heat stroke is most severe form of heat illness. Sometimes during summer season, many in TV and other thing we might have heard that people in Palakkad, Coimbatore area, they get sunstroke and other thing. So normally what happens is that our body's core temperature is increasing. When it is increasing, there will be loss of water from your body, and there will be dehydration, and it can cause death or permanent disability. So in case of heat stroke or sunstroke, this is what is happening. Dehydration will be there. What we can do, move the person to a shady spot or indoor. If it is outside, call for emergency help and give them, have the patient lie down with the feet elevated. See, this is how the feet should be always elevated if you are putting the person, so that more blood will be coming to the heart area. And if still conscious, have him sip cool water. So this is another thing. Remove his clothing so that he get more comfortable air. Use fan to direct air into the body. The purpose is to cool the body, and call for cool the person by spraying with the cool water. So heat stroke is happening when the core body temperature is increasing. Anything that we can do to cool the body in a comfortable way, that should be done. And these are the techniques that we can do. Here, what are the symptoms? Dizziness, heat, and very high core temperature. Normally our core temperature will be around 37 degree, and 3 degree rise is there. So that is too much. A lack of sweating, that is also an indication that the body temperature has increased. Behavioral changes such as confusion, that is brain is affected. Muscle weakness, nausea, rapid heartbeat, unconsciousness. So some people may not recognize the arrival of heat stroke. Only after some time they will realize that they have experienced heat stroke. So these are some of the common things that we can do in case of different type of first aid. And these are the common type of first aid kit essential. Bandages should be there, sterile gauze should be there, antiseptic creams should be there, pain reliever, disposable glove, CPR, face shield, cold packs, sterile dressing, ointment. For example, there is an ointment known as Silverex. Silverex is a common ointment that you can purchase from a medical shop. If there is some burn injury from kitchen, like splashing of oil or something, you can immediately apply the Silverex cream or that, so that this boil formation, this inflammation, swelling of skin may not take place. So it will, so that recovery will be more faster. So this kind of burn ointments like Silverex can be kept at home, so that burns may not get worse. Then, so if there is severe bleeding, loss of consciousness, chest pain, difficulty in breathing, and if you feel that there is a fracture or burns, in all such situations we have to apply. Normally, if you dial 112, 112 is the common emergency number. It will take you to, so that is a number. And if you want police help, the police people will come. If you want fire force, they will be coming. If you want ambulance, so this is, now we have a common emergency number. Earlier 100 for police, 1014 for fire force, and ambulance I think 102. So now it is a common emergency number. So these are some of the things. Then nowadays giving them accurate location is more faster. So giving them a proper location so that ambulance team can come. They can immediately reach. Even if nowadays police have a better ambulance service, even if in a remote area they will be calling the nearest ambulance provider and they will be coming. So that calling 112 is one of the best way to get help. Then this is the final part of that. First aid and emergency care are very critical in ensuring the safety of the person, and always be trained in using this first aid. I will show you one first aid thing that you should practice. See this CPR, this video, this is a very small video. See, this is a small video, and see this video. Sometime learning this is very important.
CPR is an emergency response technique to help keep blood circulating in a person who has suffered cardiac arrest.
If the person
CPR
has a
can
cardiac
increase
arrest,
chances of survival for
is
cardiac
the
arrest
first thing that
victims
you can.
outside a hospital by 2 to 3 times. If you find yourself near someone having a cardiac emergency, call 911 immediately. If they are unresponsive, not breathing, and do not have a pulse, perform CPR while you await for emergency personnel to arrive. If you're unsure of what to do, listen to the emergency dispatcher for directions. Next, position the person on their back. Tilt their head back and listen for breathing. Watch to see if their chest is rising and falling. Feel for a pulse on their neck. If no breathing or pulse is detected, begin CPR. The main purpose of CPR is to keep the blood moving so that it continues to reach the brain and other vital organs. Place one hand over the other and press firmly in the middle of the chest. Begin 2 compressions per second, or 100 to 120 per minute, and press down at least 2 inches in depth with the heel of your hand. People with CPR training can pause every 15 or 20 seconds to give 2 rescue breaths, pinching the nose and blowing into the person's mouth until their chest rises and falls. For untrained individuals, hands-only CPR can also be performed at the direction of 911 dispatchers. Continue the CPR until the person responds or until emergency responders arrive. To perform CPR,